Hi, I'm Dr. Paul Fisher, and today we're going to talk about the exam that we do for spondylolisthesis. Last video, we talked more specifically about what spondylolisthesis is, its history, typically the complaints we see with patients. Today, we're going to show how we see that and how we test for it in the office. So the first thing I do at every exam we have with every patient, and a lot of the things that you'll see, exams that we do when we suspect spondylolisthesis are the same for almost every exam we have with patients, is because we're really evaluating how the entire body works. So one of the first things that I do as a chiropractor is I'm checking posture. Many times with patients with spondylolisthesis, like I said, they'll be shifted forward like that. This is something that many times you can even have people check and see in the mirror. If you look, your shoulders should be lined up with your hips there. They'll be shifted forward like that. Even just doing that, that puts extra pressure on the back. That's one thing that I'm looking for. We'll also go through a range of motion exercises. Many times they'll be limited in flexion or extension, and especially pain in ranges of those motion. Range of motion, that's really good to see too, is like, are they limited? Are they limited with pain? And then we'll test that range of motion. Typically we'll do it standing. Then we'll also have the patient do it sitting. When you do it sitting, technically it should almost be a little bit more difficult because you don't have gravity assisting you, but sometimes we'll find patients that can actually do that even easier. So that's a clue that we've got something else going on. And another thing that we're looking at with posture is we're actually evaluating beyond just what I see, but we use a program that comes on an iPad called Posture Screen that we're able to quantify the posture. We're able to see how much somebody shifted and then what their tilts are side to side. And as we go through care, we can measure these. We can see how patients are improving, what's changing. Then, like I said, we do range of motion. And another thing we do with range of motion is we quantify that as well. We use a system here called JTEC, which allows us to quantify that really within about a 1/10 or even more so of a degree. And this allows us to see how that proceeds throughout care. Range of motion typically should not only be improving, but it should also be improving pain-free. Now, one of the other things that we look for in the office is muscle strength. Now, the old way of doing that was, all right, if you've ever had a doctor test this, like, all right, push down on your leg like this, shoulders like this. And we're just starting really implementing this in the office. This is brand new equipment, really excited. It's the best available that there is. And we're able to quantify how much force people are using when they're testing. This is another great way to say, all right, are patients improving through care? Are we seeing positive changes? What changes? And what's great about this too is that when we see a change of, an older patient who goes from 50 joules to 75 joules, I mean, that's huge. That's a 50% improvement, but that level of change is barely perceptible by what you're able to test. And then also when we have some of our patients who are younger, who are more athletic, who've been exercising beyond what we do in the office, and they're really here to get to the next level, we're able to quantify that as well too, which is really exciting for us in the office. Also, for a lot of our patients too, we do grip strength testing. And this is phenomenal because it's just how hard can you squeeze? We're finding more and more that's a phenomenal predictor of overall health. This is especially in some of our older patients, but as patients progress through care, it's amazing how just the whole body works better. Going back to spondylolisthesis though, we're really testing the lower extremities, their legs, how strong those are. Can they lift up? Can they kick? Can they pull? If it's necessary, we'll also do extremity testing. With that, we're doing the sensations. We'll test the vibration, which is this guy right here, reflexes, pinwheel, hot and cold. And we're really testing to see how all those nerves work. Now, based on what we see here, we'll typically proceed to an X-ray. We see on this X-ray that L3 has slipped forward on L4. Now, typically we see this in the L5-S1 region, but we wanted to show this film because when we go to treatment, we're going to show the post-treatment film, and you'll see what kind of a change we can make. X-ray, the absolute best way to tell what's going on with the spondylolisthesis. Palpation, people being able to feel. If you can feel a palpation for a spondylolisthesis, that's so bad, that's probably most likely almost a surgical case. The X-ray is the best way to tell what's going on. And then also, depending on the case, we'll do a flexion extension X-ray. We'll see how stable is that. Is that moving? And when we talk more about our treatment at their next visit, we'll actually do a stress X-ray where we'll have the patient lined up in traction and we'll see what kind of a shift do we get with that. Does it make a difference? Is our traction doing what it's supposed to be doing, what we think? Do we have the ability to create movement there to restore that bone back to where it's supposed to be? But like everything, we do in this office, the most important part is the history, and that's tied right with the exam. We've got to know what's going on with the patient, and we've got to adequately diagnose what is going on and if we can help. Our next video, we'll talk what we do for treatments for spondylolisthesis. Again, I'm Dr. Paul Fisher with Gold Coast Chiropractic. Thanks, and have a great day.